Good afternoon and welcome to this quarter's town hall meetings. Bob Craig and I are going to take you through what's happening at Union Hospital over the next 30 minutes. We always like to start off with an eye care standard. I've already worked my way through all of the letters and I'm back around to eye again. So we start off with eye. For integrity. We put some things up there to just jog your memory, like maintaining confidentiality, being sure to use keywords at key times, making sure you do your best in all work and work relationships. We don't put these up here just as this is the only thing. We really put it up there to say, think about it when you're at work and go, what am I doing in the day-to-day activities that shows integrity to the patients or the visitors that we have here at Union. Next thing I want to do is start through the quality. Leapfrog is a corporation, or it's set up by a lot of corporations in the country to evaluate our patient safety and quality. They do report cards with all the hospitals across the country. They give out grades A, B, C, D, F. If you go out and look at all of those, you'll find there's one of those in every letter in the state of Ohio. Our rates tend to be a little bit higher. About 20% of the hospitals in Ohio received an A, and we're very happy to receive an A. I think of the last 5 years, I think we've had an A 4 times and a B once, so we want to stay at the A as long as we can. We also had another award, and this goes to the inpatient rehab unit. This organization called Uniform Data Systems really looks at the functionality of how the patient comes in the door versus how the patient leaves, and the difference in that functionality. The improvements were so well in Union's inpatient rehab unit that we ended up in their top 10%. So we're real proud of the inpatient rehab unit for doing that. We've changed what we're looking at as quality. The core measures that I've been showing you every quarter has really sort of changed because as CMS begins to look at some things, they've added things and deleted things. So now we're looking at a few different things. This is the hospital-acquired infections, and obviously you want all zeros there. We don't want any patient to get infected while they're here at the hospital. However, we know that happens, and you can see where we've had some of the results. UTIs, hospital-acquired pneumonia, there's 3 or 4 of those. However, I'll go back and say, if you were to look at these numbers and look at them across the quarters, you probably would see that we're somewhere 12, 15. If you were looking at this 2 years ago, we would probably been between 30 and 40 on those for a year's worth of data. So we have made a lot of progress in improving that, but we want to get everything down to 0. This one's probably the one that I think most upset people, eclampsia. We had a central line infection. It's the first one we've had in 3 years. So that means we get to start over counting the number of days since we've had one of those. So that's a little upsetting, I think, to the caregivers who have been working so diligently to keep that at 0, but we'll get back there. Process measures, we've changed those, and if you look at these things as well, you'll see that we have some different ones by different specialties. The first one's an OB one. American College of Obstetrician and Gynecologists are trying to make it where no one gets an elective induction in under 39 weeks. You can see we're close to 0 on that. Influenza vaccine, we want to get everybody at 100% during those quarters when we do that. We're in the 90s. The stroke measures, we were running around at 100%. We did miss one the last quarter, so that one dropped down a little bit. Transfer times for an AMI. If you come in having a heart attack, we really want to get you transferred within 60 minutes. We normally do that. If you can see, those numbers are generally in the 30s and the 40s. If you look at the last quarter, it was in the 70s. This is the power of missing one, because you get an atypical presentation for an AMI in the emergency room. You figure out after they've been here for a while, and the transfer is about 200 minutes. You're going to run that average up. Now, it wasn't a bad outcome necessarily for the patient. It was just something that appeared there. But that's going to be our data that's sitting out there in the points for that particular quarter. Time to eat if you arrive with chest pain or an AMI, we want to get your EKG done within 10 minutes. We've been struggling a little bit with that one. You can see we did it 1 quarter, but we're continuing to work on that. We've done very well on the bottom one. This is from the time you arrive with a long bone fracture until you get your pain medication. Now, the average time across the country is 67 minutes. We've been consistently below that in the 40s and 50s. The reason that one is kind of interesting to me is because at my end of the world, I sometimes get those calls when people don't feel things went right. And I'm always amazed at the number of people that expect their loved one to get pain medication as soon as they walk in the door. without understanding that our process is we've got to figure out if that pain medication will do you more harm than good. So there is a process that's there between the time you walk in and you get the pain medication. We want to minimize that, but it's not always immediate, and that's sometimes difficult for people to understand. Same thing with hand hygiene. If you can see, we've made a tremendous amount of moving up in the last couple of years, but we're at 91%. That's not something we're going to go out and advertise, and you don't want to go out and tell your friends and neighbors we wash our hands 90% of the time, because they expect us to wash our hands 100% of the time. We expect ourselves to wash our hands 100% of the time, but we miss it a few times. So we're continuing to work on that. HCAHPS is the data that we look at from our inpatients. This was started by CMS. It's a CMS monitored program for all Medicare patients, but we actually kind of ask the information for all of our patients as well now. The last quarter actually was pretty good in this one, because you can see the 9s and 10s went up. Recommending UH went up, the communication with our nurses went up, the communication with our staff went up, and actually when I finished the April data, we were at the 89th percentile on responsiveness of staff, so we're doing really, really well on that. And the communication with doctors was a little bit higher. Hospital environments has stayed pretty close. Pain management kind of dropped the last 2 quarters. Communication regarding meds was pretty steady, and discharge instructions had a pretty good sweep up. So in general, we did a pretty good, had a pretty good quarter with regards to our folks responding on the HCAHPS. We do give a regular Press Ganey survey out for the inpatients as well, because some departments don't get their information through HCAHPS. The one I can think of most often is food service. All the food service questions are in this one versus in the HCAHPS. And you can see that's been pretty steady across several quarters. ED has been up and down on their responses. Outpatient has moved up and is holding kind of steady. First care is a sawtooth. It goes up and down every other quarter. And then ambulatory surgery was making some pretty good ups and downs and then kind of dropped. But I always want to tell people that when you look at those numbers, particularly on ambulatory care and to a certain degree outpatient, the raw scores are still very high. This may be a difference of a 92 and a 93. It's particularly hard in ambulatory surgery because freestanding ambulatory surgery centers are lumped in with hospital-based ambulatory surgery centers. And the freestanding folks don't have to play by the same rules that we do, so they can move people along a little bit faster and tend to get a little bit better responses on some of their stuff. So when you're looking at that, those jumps can be just a few points on the raw percentages. I'm going to turn this over to Bob Craig now and let him talk to you a little bit about finances.
Okay, I'm Bob Craig. I'm going to be talking to you about the first quarter financial summary. This is our first quarter results for 2015. It's just the hospital side. It doesn't include TASC or UPS. And you'll see that at the top there, our billings for the quarter were about $17.6 million on the inpatient side, just a little over $39 million on the outpatient side. So about 70% inpatient, 70% outpatient, 30% inpatient, which if you were here 20 years or so ago when I came, you almost saw the opposite condition. We were about 70% inpatient at that point, 30% outpatient. Over the years, as most hospitals have transitioned, more and more of our services have moved from the inpatient side to the outpatient side. So we've gotten to the 70-30 point now almost. For total billed charges for the quarter of $56.8 million. From that, we discounted away 54 cents on every dollar, essentially. $31 million worth was discounted from insurance allowances, bad debts, and charity. So our total receipts for the quarter were almost $26 million, 46% of our total billings. From that, we received about another $1 million from other sources, everything from chicken tenders in the cafeteria to physician leases to a significant amount of meaningful use funds. Our electronic health record funds are in this amount too. So total collections for the quarter were almost $27 million. From that, we spent about 54% of our revenues on salaries and benefits for all of us that work here. Another $10 million on supplies and services and other expenses, and then almost $2 million in insurance, depreciation, and interest. So our total expenses for the quarter were just under $27 million, which left us with a small margin, about $82,000 in bottom line net income for the quarter. We do rely on a lot of money throughout a year, almost $5 million of what we call one-time or special program money, HCAHPS and reimbursements we get from payers. So we're still in a pretty challenging financial environment, as most hospitals are, but we are able to make small operating margins. So that's a positive results for the quarter. This is our continuing graph of admission and patient day trends. On the inpatient side, the light line is the admission line. We were down about 5% in admissions from this time last year, about 2.5% in patient days. So we're continuing to see that decrease in inpatient volume that we've seen for the last 5 years here. On the outpatient and ED side, the darker line, which is our ED volumes, did trend up a little bit this year. It had been trending down slowly, but we've been projecting that number to be about 1% to 2% increase a year. And that's what we built our emergency project volumes on. So it's good to see that number rebound. Outpatient registrations, the lighter line, has been pretty steady since 2010. On surgeries and delivery volumes, the darker line is our surgical volume. It was trending higher and then dropped a little bit between 2012 and 13 and has been pretty steady since then. We're hoping that some recruitments of additional surgeons might help us to see growth in surgical volume, because those cases are important and tend to generate a little more in terms of revenue. Delivery volume, you'll see, has been pretty steady since 2010. A new program we started in the quarter is the Anticoagulation Clinic. This is being offered in the first floor of the Boulevard South, sharing space with the cardiology department. It's been under consideration for a while. It's a very popular clinic in its initial month or so. Dr. Hadid is our medical director. Hallie McGlumphy is our pharmacist who's staffing that area, and it's been very well received by patients, and hopefully it will help those patients who need to manage their Coumadin levels. In this kind of a setting, a lot of physician practices don't do that anymore routinely as part of the practice, so it gives those patients a way to get some Coumadin monitoring. Some new things programmatically here at the hospital. We have been recycling for a number of years large items like corrugated cardboard, but we are now beginning to recycle more consumable products, paper and cardboard, and all those commingled things that you recycle at home. Styrofoam is not a recyclable material, but otherwise these blue containers are around the hospital in the cafeteria, most of our vending and waiting areas, and it does help us. Even through the first month, we've sent about 1,400 pounds a week to the recycling center, which is waste that we don't have to put in our main dumpsters, we don't pay for as part of our solid waste expense. Plus, it's just good for the environment. So it's been a long time coming. A lot of thanks to your lead and some of our hospital employees who were behind this program. So please do take advantage of that. And we're also modifying our smoke-free policy. Again, we've been smoke-free on the campus for a number of years. We're taking that to the next level now. We also have had a dress code policy that doesn't permit employees to come into the hospital working with smoke or odors on their clothing. So the next step of this policy is that effective July 1st, we won't be permitting employees to smoke during their work shift. Essentially, from the time you clock in to the time you clock out, we'll be asking you not to smoke. It is important to our leadership in the community that we kind of take a lead in this to show that smoking is obviously bad for your health and to be a good steward of that. So this is the next step in that process. You all know that our health insurance plans do cover smoking cessation products subject to our deductibles and copays. We also have an employee assistance program which provides assistance as well. Mary Marshall, one of our in our wellness department, is a coach trained in smoking cessation. She provides classes. So if you are looking for an incentive to quit, this is a good incentive, and you're looking for some help with that, please contact the HR department. It's also the first cash out under our paid time off program. If you went to the sessions last fall, you heard the way that program works, and there are 2 opportunities in a year where an employee can cash out PTO hours. The first of those opportunities is the last 7 days in May. The second opportunity is at the end of the year, at the holiday time. But in the last 7 days of May, non-exempt, non-ONA employees have an opportunity to cash out PTO. You can cash out up to 40 hours a year from either your active or your bank. And the value of those hours, again, you'll recall, is based on your cumulative hours worked and paid. So if you have an interest, in cashing out any PTO time in May, do call Human Resources and they can guide you through that process. Wanted to give you an update on the Emergency Center project. You've all seen what's been going on. We've been essentially moving a lot of dirt, doing a lot of the infrastructure items that once we're completed here you'll never see again, but we are beginning to see now some foundations and walls and stairwells and things come up out of the ground, so it's a very exciting time. Again, the project is scheduled to open the new ER in the spring of next year, about this time next year. Then we'll have a transitional phase where we have to go up and work on the waiting room area and the old express area and convert those. So the whole project will complete next summer is the plan. So we're pretty much on schedule. Probably by the 4th of July there'll be a building standing there in terms of its steel structure. You'll be able to get a feel for its size. You can obviously get a feel for the scope of it just by seeing where the walls are. So if you're going to be working in the new ER, you might want to go look out the window and get an idea on distances. It's going to be considerably larger than it is now. One of the things we wanted to share, and we're going to share little snippets over the next few town halls, is a little walkthrough animation of the project. We'll start here with the emergency lobby. It is, if you recall, the same entrance location we have now. So the walk-in patients will still come in the same entry they do now, but it all gets reconfigured. We're standing outside the entrance now, and one of the main benefits of the new entry area is a large canopy that people will be able to park underneath and drop off, which is a significant benefit from what we've had. The other big benefit we've been experiencing the last few months is the new parking lot up at the grade level, and that was nice during the winter. So as we just kind of walk in, we're going to walk in and do a little turnaround, but we have a larger vestibule, lots of wheelchairs, storage. Normally what you would see straight ahead is the registration window, but you notice that that area gets enlarged back into the existing ER, and we create a larger waiting room. That hallway there is the hall back into the hospital, just to get you your bearings. This area is where Express is currently, and that becomes the triage entrance because all of the ER proper treatment areas are all new. So you can get an idea here as we do a quick 360 in the waiting room that gets reconfigured, it gets enlarged. We create some new restrooms for the public, some larger areas, the dedicated children's area, just more space in the emergency entry area, new vending area. That's a view back out the front, and then registration and triage entry are over there where Express is currently. So coming to a hospital near you in 2016. One other facility-related thing, you may recall we've been talking about the pod concept with UPS, the idea being that we would locate our physician resources in centralized pods as opposed to having offices scattered all over the community. So the central pod here on this campus has opened a few months back in the old Dover Orthopedics building. This is an artist concept for the UPS North pod, which we're designing now. The actual land details haven't been worked out, but it's planned for North Dover. This would be the location for all of our physician resources in the North Dover area. And it's scheduled to be completed in 2016. Now I'll go back to Bruce for some other information.
Well, one of the things that we have to do in order to grow is to add new physicians. So we've had several people begin to join the staff for the summer months. Dr. Goff is a sports medicine physician. He did his family practice residency at Altman, and then he went over to Ohio State and did his sports medicine residency there. As a matter of fact, I just learned in the last couple of weeks he was actually team physician with the Ohio State football team the last time they won the national championship. So he does have a rich history in sports. He's been working up at SUMA for the last several years and coming down and joining East Ohio Ortho. He does a lot of stuff with the sports medicine, where a lot of kids with the athletic trainers and that sort of thing. But of course there are people, older folks like me that are weekend warriors that sometimes screw up their knees or do things and he'll get to see those sort of things. He's actually a physician that tries to keep you out of surgery in orthopedics. So he started about 2 weeks ago, 3 weeks ago now, so he's getting his practice up and going. Dr. Miller has been in the Newcomerstown area for a while. She was the last of the docs that was over at the Arrowhead Clinic, employed by Coshocton. I think we've either all employed all their docs or Trinity Twin City has employed them, so she's the last one to come over. I think it's the first week of June. She'll be joining Dr. Burrier and Dr. Colson in their practice. We have 3 other physicians who are committed to coming this summer. Casey Prokowski is a local guy who is finishing up his residency in family medicine at Altman. He will be here at the UPS Central Old Dover Ortho office starting, I believe, right after the 4th of July. Also, right after the 4th of July will be Dr. Lindsay Moore. She, again, is local. She's from Carroll County and is coming back to practice. She's a dermatologist. Her temporary location will be in Dr. Arafu's old space before Dr. Arafu moved into Dr. Bravo's old space. We're playing dominoes now. But her permanent location will be at that new North Pod building that you just saw. We're building her office in there. And then Dr. Will Burgett is finishing up his fellowship in major joints. He basically is going to come and take over the hip and knee business that Dr. Scott Holder's been doing. Now, Dr. Holder's not necessarily leaving the practice, but he's going to get out of doing surgery and really sort of start doing non-surgical orthopedics on at least a part-time basis after Dr. Burgett gets here. We do have one general surgeon that we're negotiating with. We're hoping that he'll be here sometime before the summer's over, but since not all the T's are crossed and the I's dotted, I can't give you that information either right now. The Board of Trustees has had a change. We have our annual meeting in April every year. Bob Moore has been on our board for over 30 years. He's a retired accountant from Moore Niedenthal. He attended his last meeting in April, and so he's retired now, and we figured out that he'd given in somewhere between 1,000, maybe 1,200 meetings, and you figure a couple of hours each meeting. He's spent a lot of volunteer time for Union Hospital over the years. Coming on to the board is Pat Warther. Pat is a nurse. She is the current executive director of the Clinic for the Working Uninsured, so she joined the board also in April, and we expect great things out of Pat. The auxiliary, of course, raises a lot of money for us. Some of you may have bought hanging plants last week. Of course, you used the gift shop, and the tree festival is another big one. But they do events all around the year. They raise a lot of money, and then once a year they give us a check. That also occurs in April. They gave us a check for $200,000 this year. They've raised a little over $3.6 million since they started as an auxiliary. The $200,000 goes with another $100,000 that they gave us last year to complete the sponsorship of that ED waiting area that Bob just showed you. They made the pledge to do that. We also recognize our volunteers. Just as we do our employees in October and April, we recognize our employees. Some of these ladies over here have been here over 40 years volunteering, and I'm always amazed that when they volunteer, some of those miserable days we had in the winter when it was really cold or really snowy and icy, we never had a day that we didn't have a volunteer here. They still get up and come. We come because we're getting paid. They come because they feel obligated to it. On the right-hand side over here, you see the New Philadelphia High School Steel Drum Band and Patty. They were the entertainment for the dinner that we served, and we got the volunteers up. They moved their drums out and let them kind of walk through there. So that's what Patty's doing with her maracas, is kind of help out the steel drum band. These are 2 of our Your League classes. This is the graduation of our first class. These are the members who are in the second class. Your Lead is a program that we've put together to try to help people who are not in management positions but are interested in getting into management positions to kind of look at learn some different things about it. And this group over here did some projects last year, one of those projects being the recycling project that we've adopted and put into place. UH Tech, we reach out to about 100 students every year that are in high schools all around Tuscarawas County. A lot of people have actually said that they have decided to come into healthcare because of this program. A large part of what we're trying to do is introduce to the fact that we're not all doctors and nurses. I think there's about 285 job classes that we all work in at this hospital. So this is an opportunity for see that there are other things that we do. So, in summary for today's town hall, first of all, we got an A from Leapfrog. We're now measuring hospital-acquired infections and different process measures than you heard before. Bob told you about our new anticoagulation clinic. We talked about new physicians. We are expanding recycling. We're also expanding and becoming more smoke-free as an organization. And we are progressing with the ED construction. And with that, does anybody have any questions?